Joyce Wong is well known to many of us. She was a pediatric oncology nurse for over 30 years at Kapiolani, and well loved by everybody. And she tried to retire in 2018, and then she was wooed back for a little while because they started up a what's the best way to describe it, Joyce?
Oh, they expanded. So we were just starting massage after we had done our research. They were going to do the actual programming for the women in the Women's Center and the pediatrics unit. So that was a big program that kind of stood on its own. And now it's well established, even without me. We did all the planning, but now the action is going on. So that's one of the reasons why they were having me back. But
so she started that up. As you know, I've seen over years and years of being a pediatrician, sometimes it's the littlest things that matter the most to the kids. They don't really care about what fluids they're getting or what antibiotics we're choosing. They care about, are they comfortable? Do they have somebody to stay with them and comfort them? Do they have ways to feel more comfortable, to feel safe, to get a smile on their faces and to know when they can go home? And having the integrative care team is like a huge part of making our kids feel comfortable and safe. And it's something that I think we can all learn from. So often we have a chance to just rush around and like try to pound through all of our tasks. And it's really important to take a moment to just breathe and to just make sure that as caregivers, we're also taking care of ourselves. And so that's why I had asked Joyce to come and share some tips and techniques with us for today. And I'm really looking forward to learning from her along with all of you.
I'm so happy to be here and to spread the wealth of information about self-care and holistic care. So thank you very much for inviting me. So I'm calling this self-care wisdom. What if being kind to yourself really would change everything? So that's something to think about. And I have no relationship with any pharmaceutical company. Okay. And we went through the questions to ask yourself pre-lecture. Can you define holistic approach to self-care? What are the 4 self-care techniques that you might know? 4 of 6 steps for holistic fitness foundation, and define thought-filled therapy. So this is some of the things that we'll be going through.
Sorry, one more thing. Now with HPH, Dr. Maxim, we won't need to do the pre-test. We'll just do the post-test. So that's different too.
Okay, good. And so what are you going to learn today? Some holistic principles of self-care. So as a holistic nurse, this is one of the things that I always promote, because we're looking at it from your whole self, mind, body, emotions, and spiritual aspects. We're going to experience 4 self-care techniques. So I decided to make the lecture experiential. So we'll be doing 4 different things today, which you can immediately apply to yourself, and hopefully you will remember and be able to use. And understand 6 steps of holistic fitness foundation. So your foundation for self-care, and define and experience thought-filled therapy. Okay. So how do we care for ourselves when we're taking care of everyone else? So this is the big thing. We all have heard the cup half full. If it's empty, where are you at with how you take care of yourself, and how that works with taking care of your patients and families? So we're going to start out by preparing ourselves for this lecture. And we're going to do it by breathing. Breathing is of such a valuable tool. You always have your breathing with you. It's for distraction. It calms your nervous system, decreases stress, and it's simple and powerful. So on the next slide, we're all going to do box breathing. So this is the first self-care that you can always use. So this is a basic. It's with you all the time, and it's very powerful and effective. So box breathing is basically thinking of a box in your mind, and we inhale and exhale, but we hold it all in the count of 4. 4 is the basic, simple way to do it. You can go all the way up to 10 if you want to hold your breath longer, but we'll do it simply at 4. So if you all get settled in your chairs and start with me, we're going to start with our breathing technique, box breathing. So inhale, 1, 2, 3, 4, and hold it. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. That's the second time. Breathe in. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Third round. Inhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Our final time. Inhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Now just take a deep breath and relax. And notice if you feel any differently, how it's going. You feel differently and what's happening with you, because this breath is something that you can use all the time. And that's called box breath. Excuse me, my husband's in the other room. Dad. Sorry, that wasn't a cat. It was my husband, and it wasn't a kid. He got a phone call. And so that's box breathing. But box breathing is something that you remember, you have it with you all the time, and you don't even have to do the whole box breathing, the whole cycle. And you just do a few breaths. You can do breathing in the morning. You can do breathing at night. You do breathing before you do a talk, before you talk to patients and families. And that's something that can really help you. It's basic, called box breathing. Okay. We can go to the next. So what I promote is the holistic approach. So you're understanding our whole body, mind, body, emotions, and spirits. Everything's connected, and the imbalance of one affects it as a whole. Health is a higher state of consciousness that allows for vitality, well-being, creativity, and joy. And our natural state is wholeness. So your consciousness is how you are. So if you're uptight and you're very anxious and a lot of things are going on, that's your consciousness. So we want to come to a higher state of consciousness, which includes relaxation and balance. And that's your whole self. So we always, everything is affected, our mind, body, our emotions, and spirit. And you know, you actually use this practice all the time, but you don't always label it. So you're taking care of your patients' bodies, their emotions and their mind, their understanding, you're educating them. And then you often talk about spirit and what their philosophy is and what's happening with them. So we do use the holistic approach, but we don't always label. But holism is the way of taking care of our patients. Okay. So this is your whole self, physical, mental, spiritual, social, and emotional. Okay. The 6 steps to staying strong. So this is the holistic fitness foundation. Quality sleep is really important. And I know many of you are very busy in your practices and your work and sleep sometimes becomes a lack of it. But remember, sleep is that repair time in your body, your whole self. And if you can maintain a balance and some quality sleep, this is really important. That's listed first. Avoid risky substances. alcohol, drugs, smoking, vaping, all these things are not good for your body. Daily stress management. If you take care of yourself every day on a daily basis, and that means doing breathing, doing exercise, doing different things that we're going to talk about, it like builds up your bank. And then when a crisis occurs, you can address it calmly, and you're in a better position to deal with whatever happens in your life or whatever happens in the medical center. Physical activity is really important. It really is nice if you can be in nature, but any physical activity is good for your body. Healthy eating, those balanced diets with lots of fruits and vegetables, and social connections. If we isolated ourselves like happened during the pandemic, it affects us whether we realize it or not. And there's a lot more anxiety and a lot less balance in your life. Okay. And then the 5 pillars of self-care: show up and be present. So I think there's a quote about Einstein they had in this article that I wrote, that he says, he's here. And when he's here, then what he does happens. So just showing up and being present and being there and being your whole self is number 1. Pay yourself first. Remember, it's like a business. If you don't take care of yourself first and you give everything out to everybody else, then your business will fail. So pay yourself first, and don't think of that as selfish. It's really taking care of yourself so you can take care of others. Learn to say no. Sometimes things come to you and you're like, okay, yeah, I can do that. I'll do this. Yeah. And then the pile gets so high that you can't do anything well at all. So learning to say no is a good quality. And then learn to state the obvious. Sometimes the elephant is in the room. It's like there's an obvious fact that everybody knows about, but nobody wants to talk about. But once it's out there in the open, then what happens is it's released, and everybody's kind of like on the same page. It's very similar to humor, how we use humor. When, say, everybody's at the bedside and then somebody says something light, or they say their truth, and then we're all the same. I'm not superior to you. You're not down there inferior. You don't have a lot of questions. You're not thinking things that aren't true. It's not. So when you do that and put it out there, it's a good thing to think about for stating the obvious and clearing the air. And then establishing your support network again. It's so important that we can communicate with each other and be social and have that network so that we can all balance and help each other out. Now, the next thing I'm talking about, which is your second experiential exercise, is to be grounded and present. So this is something that we don't always think about. And it makes such a difference in how you will be with other people. So grounded, if we think of our body as an energetic thing, we have a higher source, and then we have all energy through our body, and we'll talk about that a little bit more later. But we actually are grounded to the earth with our feet. And when you're grounded is when you feel settled and relaxed. You feel like you're in a good place. And your presence then is what a healing presence. So your presence is what comes to your patients, is just how you are, and they feel it. So it's more of a feeling type of thing because your healing presence is there. If you are grounded and present, then your patients recognize it, but they don't necessarily say it, but they'll feel more comfortable and things will go smoother. So a good way to do this is to take a deep breath before you enter a patient's room. If you do it automatically and you start that habit, especially in the new year as we start, just take a deep breath, let out anything that does not serve you, take away any thoughts that aren't reflective of what you want to do in this moment, and then ground yourself. Think of yourself like a tree, and your roots are down in the earth, and you feel really strong and settled. And then of course your tree goes up and to the balance and to the other parts of yourself, which are also present. Set your intention for the highest good. This is a no fail tip. So when you set your intention for the highest good, it always is good for everybody, because even if things are going a little awry, you're going to try to turn it around and it will always be for the highest good. Listen to your heart. If you're always in your head, then sometimes you get too academic. But if you go to your heart and you become your compassionate self, which is always there, then it will lead you in the right direction. And remember, you're in partnership with your patients and families. So you have all the medical details, but they are putting in their input too. And this is a basic principle of holistic care, is that we are in that partnership with them and our patients and the families, and especially in pediatrics, we have the whole package. And this is a good tool to use before seeing each patient and family. So remember, grounded and present. Your healing presence is really important, just in your presence. Okay. So I want to lead you in our third experiential exercise, and it's called a chakra meditation. So if you look at this picture and you know anything about energy, we are bundles of energy throughout our body, and they're called chakras, and then we have a field. So each of these chakras, each have a specific role. And I turned it into the teaching into a meditation. So if you get comfortable in your chair and feel with your feet on the floor, I'll lead you through the chakras and help you to balance your chakras. And that will give you some insight into the energy of your body. So get comfortable, feel your feet on the floor, and once again, we'll breathe. So take 3 deep breaths, one at a time. Breathe in deeply. And when you blow it out this time, blow it out like you're blowing your birthday candles out. Blow out all that does not serve you. And breathe again. And out. And the third time, breathe in. And then blow it out. Feel very relaxed, sinking deep in your chair. Should be comfortable and at ease. Set your intention to balance, knowing your mind, body, emotions, and spirit are connected and flowing energy. Feel comforted and in a healing place. Allow your breath to bring you to a peaceful place and feel energy moving upward through your body, through each chakra. Close your eyes and you can see colors as we move through the body. Red starts in your feet and is connected to the life force. Orange is your sacral area, holding emotions, feelings, and creativity. Yellow is in your solar plexus, above your people, and is your personal power and self-esteem. Breathe and feel a warm balance in these areas as we move to green. This is your heart chakra, in the middle of your chest, and it's the center of love, peace, and relationships. You put your hand on your heart and feel love for yourself, your loved ones, and our compassionate community. Blue is the throat, and you speak your own truth. Speak and listen. Indigo is your third eye at the middle of your brow. This is your intuition, dreams, and vision. The crown, or the top of your head, is your spiritual connection, oneness with a higher source, and divine inspiration. Take a deep breath now and allow warm balance and peace. Think of a rainbow that moves from the top of your head slowly down to your feet. Relax and breathe naturally. Feel the comforting warmth in your body. Be gentle with yourself. Honor your feelings and emotions, especially as you face heartfelt challenges, stress, and anxiety. Rest in the warmth of your physical body and feel a natural rhythm. Allow your body to surrender to the rise and fall of your breath. Allow easy breath and warmth of your body to support you. Placing your hand over your heart, you are not alone, and you feel a connection with your inner light through all the colors of your body. Expand your breath and feel support in your body, mind, emotional self as your spirit connects and expands. Embrace this time and allow yourself to be comforted. Set intentions to care for yourself regularly and know this wisdom. Send kindness given to others to yourself. Notice your comfortable, quiet breathing and feeling relaxed. When you are ready, take a deep cleansing breath and slowly blink your eyes open. So that's the chakra meditation. And so what you've done, have gone through each of those bundles of energy in your body and balanced them, rotated them clockwise and balanced them to become more balanced and relaxed. When you're relaxed, everything goes better. That's what I always tell our patients when we're giving them healing touch, and they're like, what is happening? When you're relaxed, everything goes smoothly, and it helps with your pain, and you're feeling more balanced and things go better. So that's the chakras that we have in our body. And we did a meditation. I highly believe in meditation, even if you only do a short meditation. There's a 3-minute meditation. There's a 1-minute meditation. I believe in going to there's a lot of apps and websites that you can look at. There's different things on YouTube. And so just find what you like and what agrees with you. And don't think that you need a long period of time, because even if you have a short period of time, the meditation will really help you to relax your body. Okay, the next slide then. So this just goes over the energy centers. And I did put in a little, if you get the packet, I put in this little pamphlet that shows the chakra energy centers. So the root, which is down in the lower part of our body, the sacral, solar. Solar is your whole self, who you are. And then your heart center is a balances out between the head, between the rooted part of yourself, the more grounded part, and up to through the throat and brow and crown, which is more spiritual. So the 7 energy centers are really interesting if you want to look into that later, and that's the basis of our energy work. Okay. So let's reassess. How are you feeling now? Do you notice the difference in when you first sat down before we did some self-care techniques? So we did breathing. We talked about grounded and presence, and then we did the chakra energy balance in the meditation form. So think about caring for yourself. And if you do little things like these exercises that we're doing now, what a difference it makes. can you tell the difference from when you first came in to now in that reassessment? And next slide. So I did have, if you're able to get the handout, I did have this self-care chakra balance. So this actually helps you step by step to do that chakra balance on yourself. If you have, say, 10 minutes, you can do it. You can extend it to 30 minutes, but you only need a short period of time, and you can actually do that balance on yourself. Of course, it affects your whole self, mind, body, emotions, and spirit. And you can do this balancing in the morning and night, and it can make a difference in your life. It gives you something physically to do. If you don't like the idea of doing a meditation and just being still, this can help. This is kind of like a meditation that is done by balancing your chakras. Gives you improved quality of life and increased joy. Okay. So joy in the workplace helps hold the healing space. So the more we can feel that joy, the less it will balance out anxiety, and all the crises that you sometimes have to face are a lot of fast-moving things. So try to maintain that joy, because it's coming from the heart. With intentional choice, setting your intention, find contentment, which is really happiness, and that can bring you more confidence and hope. Okay. And then I have one last tool for you. Thought field therapy, or TFT, is a simple tapping procedure to help relieve anxiety by releasing blocked meridians. I don't know how many people have been exposed to this, but this is a really effective tool that empowers you and helps you to kind of relieve that anxiety. I really like it for anxiety. When I was still in the hospital, my patients that we taught it to were the most anxious, crawling off the wall patients, and teaching them, you could see a big difference in how they were able to do this tapping procedure for themselves and then able to relax. So anxiety is the primary thing, although it does a lot of things. Okay. So thought field therapy, in briefly, is applied kinesiology, and it was started by Dr. John Callahan. So he's the OG, he's the first one who started it. And now there's a lot of different things on different websites and different people who are doing it, but he's the real deal. He actually created thought field therapy. He's a psychologist, and he was trying to find better ways to help his patients that were especially anxious, phobias, different areas. If you read about it, you'll see the work that he had done, and it does work on the meridians. So acupuncture is a holistic method of working on the meridians with needles, but this is working on the meridians without needles. So we're tapping on the meridians and unblocking energy. It's a very simple procedure, and so we're going to do it now. Okay, and the next
Joyce,
slide.
may I interrupt and ask a question from Linny?
Yes.
That's in the chat. She
Yeah.
wants to know in what ways it might be like EMDR or different from EMDR.
What is EMDR?
Linny, are you talking about the PTSD treatment with the eye movement? Is that what you're talking about?
Yeah.
Oh, okay. That is a completely different procedure. So I don't know a lot about that, but I have read about it, that the EMDR, are you folks using that EMDR?
No, I don't. I haven't, but I went to training. They demonstrated that, that's one of the similar. That's why I'm wondering, like, the difference between this and EMDR. I cannot speak too much about the EMDR. I'm not.
Does it work? Does EMDR work on meridians?
I cannot speak on
philosophy
that.
of the meridians.
Yeah, it
throughout
does
our body.
really
does.
help a lot with. We use tapping.
Yeah, so I don't know a lot about that because I haven't done that, but I would maybe it has a similar effect, and it's just a different technique. This is a specific technique that he developed, and he kind of researched it through his own patients, and then it became more and more popular. So we actually have have a doctor here in Hawaii who is trained under him, Dr. Carrie Sakai. I don't know if you've heard about her. She used to be at Kaiser and now she has her private practice, but she's done wondrous work in Rwanda on the genocide victims. And so they were just in crisis, like such a simple communities, and they just totally went into crisis after all of the trauma that they went through. And she annually goes over there and teaches them thought-filled therapy, and they make like 100% turnaround where they're laughing and happy and dancing. I think because they don't carry a lot of other baggage. They're just very simple people in this crisis, and thought-filled therapy has done a really great service to them. And she's written many articles and published it, so you can look that up too. I have that in the packet, one of the references. But so I think that this technique is probably maybe the same results, because I don't know much about the eye technique. Although I have read, a few things about it, I haven't learned about it. So
we do have a couple psychiatrists on the call, actually, and one of our colleagues, Assad, mentioned that both are useful for PTSD. So Assad, I don't know if you have anything else to add before we try it out for ourselves about sort of similarities and differences in a nutshell.
Oh yeah, sure. Hi Joyce. Sorry.
Hi Assad. It's so nice to meet you.
Happy New Year. Yeah.
Happy New Year.
Yeah, I use EMDR and thought field therapy both in my practice. They're both, I guess, different than like talk therapy. Both are helpful for trauma and PTSD. Yeah, some similarities is that, yeah, both may have some degree of like touching on the body sometimes. What the mechanism of that is not really elucidated yet, but they're both have a good amount of evidence for, helping with PTSD and trauma, especially for folks that don't necessarily want to go in depth and like talk a lot about their trauma necessarily in therapy. So yeah, no, I think it's cool if we try some TFT now with Joyce. Yeah.
Okay.
Thanks.
Assad and I did research together. And Assad helped us to establish our healing touch program at Kapi'olani. So nice to see him. So let's just practice the technique. Okay. So primarily what you're going to do is think of something that makes you anxious. So this is going to see if we're going to be able to tell if it's working or not. So think of something that makes you anxious, something that is difficult for you. You feel anxiety, because we're working on anxiety. And then rate it. We'll do it really easy on a 1 to 5 scale. And then how severe is it? Okay. And now we're going to start the tapping. So the basic procedure is to start at your eyebrows, right above your eyebrow. And then tap, 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 tap. Your body likes a nice rhythm. So we'll just keep it nice and rhythmic right above the eyebrow. This is the first place that we tap. And keep in mind the thing that's making you anxious so you can evaluate. And then we move to the side of the eye. You feel that little bone on the side of your eye. Tap, tap, tap. And under the eye comes next. Under the eye and the ocular bone. Tap, tap, tap. Just a nice, smooth rhythm of hitting those meridians. And then going under the nose, above the lip. And the body knows if you happen to have your only one hand available, it will take care of both sides of your body at the same time. So sometimes if a patient has an IV or a cast or something like that, they can only move one hand. They're still able to do it effectively. And then we go to the chin right below your lip. And the next move goes to your side. So about 2 inches below your armpit, you're kind of like giving yourself a hug. You're tapping to the side. This meridian really allows for relaxation. So I've had patients who are just very, very anxious. Like they don't think the hospital is not agreeing with them. They're having a really hard time. Gone in and talked to them and taught them this. And then you can see really dramatic results. We're going to do it 3 times. And this one is find your clavicle. This movement is to find your clavicle. And there's a little soft spot right there, right below the clavicle. You can be tapping over there. And this completes the sequence, but I also add going to the end of the clavicle, there's another soft spot over there. And I like to tap there. I learned that from my original instructor. And that's the basic sequence. You can also add in tapping the top of your head, but Callahan's technique doesn't do that. But that also, when you start out, you can start with the top of your head. So now we're going to do it a second time. You can kind of evaluate in your mind how your anxiety level, if you noticed any changes or if anything's different with you. I'm going to tap above the eyebrows. Tap, tap, tap. And we're going to go through this same sequence. And then to the side of your eye. Just kind of relax and breathe naturally. Under the eye. And above your lip. To the chin. And then to the side once again. This is a good time to take a nice breath and kind of release and feel relaxed. And under the clavicle once again in that soft spot. And to the end. And kind of breathe, evaluate, and we're going to do a third time. Up to the eyebrows.
On the third round, Joyce, can you show again where to tap on the side when you get there, please?
Okay.
Thank you.
To the eyebrows. The body really likes rhythm, and we just have a nice natural rhythm going to the side of the eye. And then under your eye once again. Above the lip. And to your chin. And now we're going to give ourselves a hug. go under the armpit, about 2 inches in that area. There's a meridian over there. One of my healing practitioners once told me that if you can't sleep at night, to give yourself this kind of hug, touching these meridians, and that is a relaxation point, and that can help you sleep as well. That's just a side note. And then we're going up to soft spot under the clavicle. And then over to the side. Okay, take a nice deep breath. And then go back to your anxiety level and remember what was your anxiety when you started, when you were thinking of something that made you anxious, and then what it is now. Can you tell a difference? Can anybody let me know if they noticed a difference after they did the thought field therapy technique?
Renata says yes in the chat.
Okay, good.
And I can certainly say for me, that's the first time I've done more than a couple of taps, like the whole sequence. And it seems it's very calming.
So it's really this is just like the tip of the iceberg. This is just a basic information that you can use, but it's very effective, and it really amazed me how effective it was with some of the very anxious patients in the hospital. Another helpful point is on the side of your hand here. And one of the our instructor, Dr. Sakai, talked to us about how she had patients who would come into her office who would be so angry they couldn't even contain themselves. And so she had taught them to just tap your hand like this, hit this meridian on the side over here to calm yourself down, and especially for anger issues. And she would, her clients would just gradually tone down. She could see how it would really help them because they knew they could do this and it would help them. And then they would go from screaming to loud voice to normal voice. And so she said it was pretty amazing. But that's just like another one she taught us. But there's the whole hands. And so if you're interested, there's a lot of information out there, and I found it to be a very effective technique too, but you may be able to use that tool. And that's thought field therapy, or TFT, just a little introduction. Okay. So now you have 4 techniques. We did our 4 square breathing. Any kind of breathing will help you, and it's with you all the time. Remember to be grounded and present. Your healing presence has so much power than you can even imagine. We did a chakra balance meditation, and I encourage any kind of meditation which you might look into. Any of the apps are very helpful. And thought field therapy, or TFT. So you have 4 active techniques which we've done during this session. Okay. And so here's a question I pose to you again. What if being kind to yourself would change everything? Always remember that your essence, your purpose in life, is an active part of healing with our patients and family. And so how you are is really makes a difference in how you present yourself and what happens. And then intentions that drive your actions and habits of behavior. So setting your intention is only a small thing to do every morning. But when you set your intention, it can change your whole day. And with your self-care, you'll be able to hear the wisdom and guidance of your inner self. So more of your natural innate healing process for yourself will appear and help yourself. Next slide. So a result of self-care could be peace. As we contribute to the well-being of others, may we find peace in our own hearts, cultivate an attitude of love and acceptance. Our hearts are filled with gratitude and our minds brimmed with enthusiasm. All that we encounter leaves our space feeling lighter than when they enter it. This is what I wish for you as you care for yourself. Oh, and this is to put a smile on your face. So this is my granddaughter, Charlie. She's 6 years old. And occasionally she gets my phone. And then these are the kind of things that I see on it. So it really brings a smile to my face. So I thought I'd show you that. So if you have any questions or comments.
I'll invite everybody to put questions and comments in the chat, but there are several actually that came up that I was kind of saving. The first question was whether you might have the handout in electronic form so that it could be easily shared with people on neighbor islands. Because if you did, then Summer could upload it to our website and people could download it from there.
Okay, I can do that. I have different articles. As you can tell, I'm old school. And so I have these different articles and things, and these, I can scan them, I think, but these little pamphlets are really nice and I can scan that as well. And this little marker that tells you about the energy center, it's very interesting because it has a lot of information on it. So yeah, I think I can scan those and get those to you so people will have it available.
That would be really much appreciated, I think, for our friends on the neighbor islands. Thank you.
I'd be glad
And
to
then
do
for everybody who wasn't here at the beginning, if you would like one of the packets, I'll be on service starting on Saturday. You can pop by at Kapiolani, second floor. Best time to find me is usually early in the morning, like between about 7:15 and 8:30, or anytime in the afternoon. And I can leave some in the hospitalist office, or you can look next door where Stacy's office used to be across the hall. That I often sit in that office. So feel free to stop by and get one. I'll throw my cell phone number in the chat too. So if you want to text me and make sure that I'm there, you can do that before you come by. There were a couple more questions. Let me see. Oh, there were some really nice comments. Renata, when you were talking about sort of helping yourself before helping others, Renata said, I think these must be quotes from somewhere. Feel free to sort of chime in, Renata, but you wrote here, people who wonder whether the glass is half full or half empty are missing a point. The glass is refillable. And then if you want to reach your goals, you must shrink the size of your butt, B-U-T, not B-U-T-T.
Very good.
And then another question that said, and I don't know if any of our psychologists, psychiatrists, or social workers might want to weigh in on this, but she also asked if children and adults who have rhythmic motions, such as touching their ear or tics, if that's like a body's own internal method of self-calming. And I mean, I don't know what your experience is with that, but my sort of intuitive response from 15 years of peds would be to say yes.
I think so. Yeah.
Okay.
I'll go ahead and put the post test on for those who might have to jump off. There's 4 questions now instead of 3.
Few more seconds maybe, and then we can close out the poll. Summer, you're muted.
It's only about halfway done. I think it takes a little longer with it.
Oh, okay. No worries. So maybe like half a minute or so.
Maybe you could go over number 1, Joyce, with everyone, and then I
Okay.
think as we go through.
So can you define the holistic approach to self-care? Your choices are physician makes all the decision. All answers are in your physical body. Looking for the whole in the diagnosis, and our mind, body, emotional, and spiritual aspects of caring. So I put a little humor in there too. So maybe my humor is too dry.
Yeah, I better get that one right.
So that's the last one is the correct answer. And then, do you want me to go over all of them?
Yeah, you can.
Okay, what are the 4 self-care techniques that you learned in experimental aspect? And so we learned box breathing, grounding in present, chakra balance, thought field therapy. So it's the first answer right there. I can't see, let's see.
Did it disappear for you?
No, I got it now. I just had to move it up. So, and then the third question is name 4 of the 6 steps of Holistic Fitness Foundation. So, sleep, anxiety relief, social connections, Jello, social connections, avoid risky substance, romance, physical activity, quality sleep, daily stress management, physical activity, and healthy eating, daily stress management, social connections, holistic thinking, physical activity. So quality sleep, daily stress management, physical activity, and healthy eating. That was a little bit long. And define thought-filled therapy. It's healing touch, it's Reiki, it's a simple tapping procedure to relieve anxiety by releasing blockage and energy meridians, or it's massage. So that's the correct answer for that one.
Perfect. Thank
Do
you.
we get through them all? Yeah.
All right, folks. Any last questions or thoughts, comments? I do have one. Maybe just we have like a couple minutes left. Joyce, I feel like one of the things that I struggle with as a hospitalist is grief, sometimes more than anxiety. We take care of a lot of kids to whom really terrible things have happened, child abuse, or, you know, just a horrible disease process with lots of complications or things like that. And sometimes that to me is one of the hardest things to kind of move through in order to keep a smile on and trying to, like, you know, be that healing presence and never trying to like center myself when I'm in the patient's room, but also sort of being attentive to how I'm feeling when I am on my own in the workroom. And I don't know if you have any thoughts for that.
I do. I think that grief is such a complicated thing. And I'm actually working with my daughter on her nonprofit called Let Grace In, because I lost my grandson when he was 5 years old. And that was her son. And we're doing so much work with the community now that I've actually learned more about how to process grief. And one of the most important things I think is to recognize that it's not gonna go away. It's gonna be part of you. Like it's that, but you keep going on in your life and you learn from it. But if you expect it to just be gone, it's not going to be gone. It's something that's there. And you know, in the talk, I talked about social connections. I think our population in medicine is very important that we talk to each other, because we can understand each other in a way that other people cannot. So if I lose a patient I was really close to, and I try to go home and talk to my husband about it, he doesn't really understand that I feel more pent up and maybe not processing it and holding it back. But if we talk to each other, we really understand. And I really promote the debriefing after a death, a loss in the hospital, because that immediate debriefing and knowing what happened and being able to say your memories and what went on with you during that process to other colleagues, and is really a big help in trying to process and live with the grief and try to grow from it, but don't ever expect that it's going to go away. It's like part of you. When I was an oncology nurse in pediatrics, I had my angels, and then I, kept them with me. And then as I developed working with holistic care, I really felt like they were part of helping me. And that's more of a spiritual aspect. And you may or may not feel you want to do something like that, but that seemed like that was very helpful to me.
Thank you so much for sharing that, Joyce. And on behalf of all of us, we're so sorry for your loss. I remember when you gave grand rounds and you talked about your Make-A-Wish trip, and I've never forgotten that.
Yeah. But I tell you, that little guy Grayson's very powerful because he's helping a lot of people now. And we're really dedicated to that, and working with people in the community helps all of us, our family too.
Yeah.
Thank you very much.
Thank you for everything you shared today, and also for just being so deeply authentic and true, and reminding us all that it's okay to be vulnerable and to have needs.
Thank you so much for having me.
And lots of thank yous in the chat as well, which I'm not sure if you can see right now, but yeah, I mean, we had a really good showing today, and we're all just so grateful to have these tools and to have a little bit more light and balance as a result of what you shared with us. So
thank you very much. I'm humbled when I see the names and some of my own mentors and people that I look up to in the medical center. So thank you very much.
All right, everybody have a wonderful, calm, and balanced week. And we'll look forward to seeing you in a couple of weeks. We'll be talking about some long COVID updates.